thank you for joining us today on Purely Positive. I'm LJ Thomas, your host, and this week's Purely Positive person is a person who works in the medical field. Check this out. She specifically works in nursing, but she's a doctor and she also is a college professor. So please help me welcome to the show, Dr. Doreen Mingo.
Thank you so much.
You are very welcome, very welcome. Now, I have a lot of questions,
Right.
of course.
All right, I'm ready.
What is the Allen College Nursing Camp?
So the Allen College Summer Nurse and Health Careers Camp is a program that we started about 7 years ago.
Okay.
And we started it for kids who have been historically underrepresented in the nursing fields, who are educationally or economically disadvantaged. We want to encourage or pull those kids into an interest in nursing and healthcare professions. And so in order to do that, we have to give them some experience with the profession. Mm-hmm. We cannot have kids hope to be something that they don't understand or know about. What we find is that many times kids don't know about the healthcare professions that are out there. They're more familiar with being a doctor or being a nurse, but they really don't understand what nurses do. They often will say, if you ask them, that nurses do what the doctor tells them to. And they don't understand the autonomy or the independence that nursings bring to the healthcare industry or environment. They don't understand that nursing is the largest segment of the healthcare workforce. They don't understand that nurses spend the most time with their patients, that the nurse is generally the one who ring your call buzzer. The nurse comes. Or if something is off or something is wrong or you have pain, the nurse is the one who comes and takes care of you and communicates that back and forth with the doctor. So if we have kids who are interested, we need to have them know exactly what the nurse does so that we can increase that interest in or build an interest in nursing and healthcare professions. There are so many healthcare professions out there, and our children just don't know what those are.
Wow, that's commendable. I used to want to be a nurse.
Mm-hmm. It's never too late.
Well, I discovered blood in the site is a problem.
Okay.
So I found other ways to help people because
that's a wonderful thing.
I like helping people. Now, this program is a summer program, so does it last the entire summer or just a segment of the summer?
So it runs for 6 weeks.
Oh.
We go Monday through Friday from 9 a.m. to 3 p.m. for 6 weeks. Okay. So kids come every day. They provide their own transportation to and from camp. But when children are there, from the time parents drop them off in the morning or they drive themselves, we provide everything that they need. They don't have to bring anything. All they have to do is show up. If there are utensils that they need, like to write, or they need pencils or pens or calculators, notebooks, binders, bags, textbooks, we provide everything that they need so that kids don't have to worry about bringing anything.
Just bring your mind.
Just bring your mind and be ready to go. We feed them breakfast. We feed them lunch.
What?
We take them on tours. We have a wonderful curriculum planned for students throughout the day.
Now, you said kids. So what ages are you talking about?
So to be in Summer Nurse and Health Careers Camp, you can be anywhere in the high school period.
Okay.
So you can have just graduated from 8th grade and be going into the 9th grade.
Okay.
Or you can have just graduated from high school and be ready to attend college in the fall. So anywhere in that high school period, 9th through 12th grade, we accept into summer camp. We have a preference for juniors and seniors, and they get kind of first dibs because those students are at a point where they're closer to make decisions about what they want to do for the rest of their life.
Right.
And our goal is to help you to see some different things so that you can make an educated decision post-high school graduation.
Wow. You just answered several other questions that
Oh,
I
I'm
had.
sorry.
No, that is perfect.
Okay.
That's absolutely perfect. So since it's a summer program, you're only enrolling for the summer. Mm-hmm. Is there an is there any consideration to expanding the program to other times of the year? I'm just curious.
We would love to, and actually my doctoral research was around building a year-round program around summer nurse camp, so that we keep kids engaged and involved. And see, I revert back. The first few years that we ran camp, it was summer nurse camp.
Okay.
This year we expanded the title to really reflect more of what we were doing, because nursing is our biggest component of the camp. But because there are so many other healthcare careers, we changed the name to Summer Nurse and Health Careers Camp. So if you hear me go back and forth, it's because I'm still living a little bit in the past. My age sends me back there, but it's Summer Nurse and Health Careers Camp, because we want kids to know about occupational therapy, physical therapy, nuclear medicine, medical laboratory science, diagnostic medical, ultrasonography, radiography, and a host of other things that they can be. And all of those things are available in the hospital. So even kids who don't like blood or body fluids, you can do computers. There's a computer in every patient room in the hospital that the nurse or the doctor can sit down and type at. So there must be a whole system of computer engineers and computer technologists who make those run. There must be a whole system of informatics personnel who make the computers talk the medical language that gathers the information so that we can data warehouse it and store it and learn how to do better things. So there's security in the hospital. Any position that you want to play is available in the hospital. So we want to bring kids to healthcare as well as some of the specialty areas in healthcare.
Very well said.
Thank you.
Look, I'm speechless. Very well said. The fact that you are working with children at that crucial age, you know, a lot of kids, I don't know what I want to do, you know. Then before they know it, they've graduated and they are clueless. And then they don't go to college or whatever. And you have to get them when they're trying to map out their lives. That makes a difference. Now, what are the, let's see, are there any prerequisites?
There are no prerequisites to come to camp other than being in high school and fitting the criteria for us of economically or educationally disadvantaged. In our educational system right now, if you are a kid of privilege, you have many opportunities that parents can afford for you to see many different things. But quite often, if you are a kid who has been disadvantaged, you cannot afford to get into some of the opportunities that allow you to see different things. So we keep those parameters pretty steady, and we operate those based on the federal government delineations or descriptions of what those are. So first generation college student, 30%, or the free and reduced price lunch, you know, those kind of things that help us know. Or if a school system has low number of graduates or low number of kids who matriculate into college, those things kind of help us delineate the federal guidelines for economic disadvantage or educational disadvantage. But that's the only requirement to get into nurse camp. That's the only requirement.
Now, just out of curiosity, how many enrollees do you generally get?
Well, the first 5 years we have 40 kids per year in summer nurse camp. The last 2 years we've went down to 30. It's helped me have a little less gray hair. But, you know, it's a little bit more manageable. When you talk about bringing 40 kids from 9th grade to 12th grade in, and we put them, our mornings are filled with classes. So they have study skills, math, and science. You have kids from 9th grade to 12th grade, they're all over the map. So it's a little more difficult for teachers to spend individual time with students with varying places on the educational map. So with 30, we condensed it a little. The groups are a little bit more cohesive, and it's a little easier for our teachers to balance their classrooms to build those skills. What the research tells us is that when kids are away from their studies, from the summer period, from when school gets out in May to when they go back in August, they can often lose what they've gained.
Right, because they don't pick up a book or anything.
That's right. That's right. They're having fun. They're on summer vacation, you know. So when we build those study skills in, or that summer time where they have math and science every day, we help them to keep what they learned, build up on it a little, and when they go back in the fall, they're ready. They've been engaged, their minds have been stimulated, they've learned some, and so they're ready to continue to build on those skills when they go back in the fall. And that's what we want. We build those in because we found that even when we did have children who were choosing healthcare careers at the college level, they were often getting sidetracked because the classes were difficult, and so they would change their majors in the prerequisite period of science or anatomy and math. So we built those into camp, so it helps kids build up skills, build up confidence, so they're ready when they get to college.
Okay, now you said something. I'm going to go back to that, but before I do that, I want to ask you a question.
Okay.
How do you know who's economically disadvantaged?
We have them fill out an application period, and we review the application. So I can tell if you're economically disadvantaged by your household income.
Right.
So estimated yearly income is what we go by.
Okay.
So they can get it off their tax return, or they can get it off their final W-2, and they report that to us. We can tell if they're educationally disadvantaged by looking at the school system that they attend.
Okay. Now, that brings me to my other question. You mentioned science and math. I'm gathering that those things are included in this particular program.
Yes, ma'am.
Because STEM is a huge thing right now, especially for girls.
And we're doing well in it, too.
Yay.
We're doing well.
Yay. How many kids would you say have graduated from the program and gone on?
We've enrolled, since we started, 2012 was our first class. We just completed our 7th year this year.
Okay.
We've enrolled 262 kids. I'm real proud of that.
You should be.
Into Summer Nursing Health Careers Camp. We've graduated 247, so that gives us a 94% graduation rate, which is absolutely awesome.
Yes, it is.
So we keep continuing to build on that. My class this year was 30 kids we started with, and 30 kids we graduated.
Congratulations.
Awesome. Thank you. I love my babies.
I know.
I love my babies.
6 whole weeks, they're yours.
Yep, they are mine. And I treat them like they're mine, too. You know, I love on them when they need to be loved. I fuss at them when they need to be fussed at. I get on them when I have to. And if I have to call a parent, I call a parent.
That's what you got to do. That's what you got to do. I really like the fact that you're working with kids. There's so many programs out there for economically disadvantaged adults or for people who have already graduated to go into a sector of career training, so forth and so on. And I've always felt like the high schoolers get kind of left out. They fall between the cracks. You know, I've always felt that way. And so I feel like, based on what you've been telling me today, I feel like this is a combination of education / mentoring program because of all the things that you do.
It is. We have our mornings. Let me tell you a little bit about how we lay out the program. Our mornings are filled with our educational component, I like to call it. So Monday through Thursday, they have either science. Well, every day they have study skills. They have an hour of study skills every day. Monday and Wednesday, they have 2 hours of math. Dr. Hilton teaches that. She comes from the college, takes her vacation time to teach high school kids.
Wow.
Because we're invested in our children. And Miss Martinez, a retired teacher, has been with me all 7 years of camp. She comes in and teaches science 2 hours on Tuesday and Thursday, anatomy and physiology. On Friday mornings, they have oral presentations, which I'll get to in a minute. The afternoons, on Monday and Wednesday afternoons, they have what's called library research. So they go to the computer lab and they research a topic. It can be a career in nursing like pediatric nurse practitioner, or it can be a health science career like cardiac thoracic surgeon, but they have to do research. Sometimes it's college application procedures, so they have to go and select a college in a particular state. They'll have to choose a big college where it's over 20,000 students and a small college, and they have to go and look up a healthcare major and figure out what are the requirements for getting in, what are the prerequisites, what do I have to do to get in this college, and then they have to write up a story. Now, how, of all the people who apply, how do I make my application stand out? What's my volunteer experience? What's my 5-year plan that I can talk about to these colleges? What are my grades need to look like? Those kinds of things. And then those presentations on their research topics are presented to the whole class on Friday mornings. So you don't just get to research it. You have to put your PowerPoint together and present it. Another topic that they do is STD, STI, and I'm big on my soapbox about that because I watch the statistics.
Exactly.
And I tell them it may not be you, but some of your friends are engaging into this behavior, and it's fastly rising in our county, and so you must be informed. So they must use the correct terminology. They must get it from the CDC, the National Institute of Health, Mayo Clinic, or somewhere that's very reputable. They must cite their source. They must put anatomically correct pictures. There's no laughing. There's no giggling. You must present your presentation. The classmates must take notes, and then we have a quiz on it after that's over.
What?
So that, Dr. Mingo will be serious about that one. So, and you have to continue to take the quiz until you pass it.
Oh.
And you must pass at 80%. So if you take it 2 times or 3 times or 4, it's okay. You just have to continue to take it till you pass. So things like that. They do their research. They do their presentations on Friday morning. That's Monday and Wednesday. Tuesday afternoons, we visit 4 units in our parent hospital. So my college, Allen College, is associated with Unity Point Allen Hospital. So it's about a 1-block walk. So we walk over to the hospital. We choose 4 units. So it may be the surgical suites, digestive diseases, the ICU, and the emergency room. And the kids get to tour those behind the scenes, not from the patient perspective, but from the professional perspective. They'll have a professional who will come in, walk them through, teach them what they do in that unit, why they do it. They've actually got to go in, surgery, see the actual operating rooms, look through the door. There may be a heart catheterization going on, or last time we were just there this summer, there was a hip replacement going on.
Wow.
They get to see that. They get to walk in an empty surgical suite and see how everything is set up, the monitors, the equipment, everything. So they get to see this from behind the scenes, again, to help stimulate their passion, increase their enthusiasm, and increase their desire to maybe want to do some of these things. And then on Thursday afternoons, we have some type of nursing skills where they may practice learning how to do vital signs, or packing wounds, or bandaging wounds, or doing a surgical scrub, some type of nursing skills. Their favorite is probably giving shots. They all learn how to give their first shot. So we do those. And then on Friday, every Friday afternoon, we load up and we get on a school bus and we go to some healthcare institution like the Mental Health Institute, or another local regional hospital that may be smaller, or some type of healthcare industry or institute, hospital across town, and we tour that hospital and look at how they do things, so that we have a comparison from our parent institute to another facility. And they've been in ambulance, fire trucks, you name it, they've done it. So it's just a really good look at what we do in the course of a day. So we put our schoolwork first, and then we have some fun. And it's just a great experience, opportunity for students to get to see healthcare from behind the scenes.
This is a very, very intense program.
I love it. I love it.
And you're in Waterloo, Iowa.
Waterloo, Iowa.
I'm in Atlanta, Georgia. I'm not going to make it. I'm not going to make it all the way up there. No. But for anyone who, do you take students, clearly, I guess not. You don't take students from other states.
Most of the time we take students who are local. Every now and then we'll have a student who maybe is in a situation where they live with mom during the school year, or live with dad, and then they come to be with mom every summer. So they'll have a parent who's custodial in Iowa who has them for the summer, and that parent can sign their children up.
Okay. All right. So for anybody who's watching, if you're in that situation, it's available.
And we'd be happy to have you. We just have to go back to their school district and make sure they're qualified either economically or educationally. And we work to do that for them.
Okay. All right. Good. Now, for anybody who is watching who wants to find out how they can contribute or help with this program, what would they need to do?
You can always contact me, Dr. Doreen Mingo, at Allen College in Waterloo, Iowa. You can go to our website, www.allencollege.edu. You can find me on the website, send me an email. You can call me. My number is located on the website. I'm not going to give it out on TV. I don't want 50,000 calls. But if you're really interested, you can find me. I'm very easy to find. And I'd love to talk to you about it or setting up a program at your own institution.
That's the part that I really wanted to hear. So you're open to expanding this particular program
I think it's
to
wonderful.
other places.
I travel lots and presenting on the program. I've been to 4 or 5 different places last year just presenting on the program, talking about the success rates. I have kids all over the U.S. in college who are going into different healthcare fields. You know, I went into the Applebee's the other day, and I had 3 graduates from my 2012 first year just graduated from college and into healthcare. One's going to be a diabetic educator. One's into global health. And, you know, it just warms my heart to see these kids going in that pathway.
I can imagine.
Oh, yeah. Makes me feel good.
I can imagine. Wow. This is absolutely phenomenal. Wow. That doesn't happen often. Anyway, lost my thought. But what I do want to say is thank you so much for taking the time to be here.
You.
These kinds of programs are things that people need to know about. And I'm hoping that anybody who is watching is really interested in bringing this program to an area where they're located, because it's these little programs that help us build a better society and make things better for people across the board. I want to thank you so much for being here today.
Thank you so much. Yeah. Thank you for inviting me. Whatever I can do to help teenagers. A teenager cannot hope to be something that they never heard of. We never know when a kid is going to have that light bulb moment where something turns on and they figure out, this is what I want to do for the rest of my life. But if we show them, they have a better opportunity of figuring out what that is. And any kid at any point in their life can turn their life around, follow their dream, and learn to do what they want to do.
Very well said.
Thank you. Thank you.
Thank you, everyone, for joining us today on Purely Positive. Please remember that being positive is a choice, and make it the best choice that you can. I'll be talking with you soon.